Can you please step back so we can give air to the patient? Please, this is an emergency. And can somebody please call 911? It seems like the patient is having a hard time to breathe. Thank you. One and two and three and four and five and six and seven and eight and nine and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One and two and three and four and five and six and seven and eight and nine and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 28, 29, 30.
BLS stands for Basic Life Support, and as a nurse, the BLS CPR guidelines are definitely something you'll need to become very familiar with, so let's do an overview of the adult AHA guidelines. Step 1 is always scan the scene for safety to ensure it's safe for you to enter. Step 2 is assess the patient for response by yelling, hey, are you okay?" while repeatedly tapping the patient. Step 3 is call for help. If they aren't responsive and you're not in a hospital setting, you would activate the emergency response system by calling 911 or ask someone to and delegate someone to get the AED. Step 4 is assess for breathing and a pulse. You'll want to check for a carotid pulse, which is located on the side of the neck, and check for chest rise or gasping at the same time. And make sure you're assessing for no longer than 10 seconds. If no pulse and abnormal breathing is assessed, you'll want to immediately start CPR with a cycle of 30 chest compressions to 2 breaths. For compressions, you'll want to maintain a rate of 100 to 120 per minute. Make sure the compression depth is 2 to 2.4 inches. Allow for full chest recoil after each compression, and pause to check for a pulse every 2 minutes or 5 cycles. Use the AED as soon as it arrives by turning it on, placing the pads on the patient, and following the prompts. If a shock is advised, the AED will deliver it, and make sure when it says clear, no part of you is touching the patient. If it advises, resume CPR immediately and wait for the AED to advise for another rhythm check, which is every 2 minutes. Follow this cycle until help arrives or the patient becomes responsive.